Hey, cancer fighters. My name is Bob Lucian. I'm a clinical pharmacy clinical coordinator actually for City of Hope Atlanta. I've been with City of Hope now more than 10 years, had the opportunity to serve with our oncologists, with our nurses, teams throughout the entire facility. It's my pleasure to speak with you a little bit about sun safety. June was Sun Safety Awareness Month. It's one of the easiest things we can do to protect ourselves from a pretty risky behavior. I mean, think about the things that we engage in every single day, which is being out in the sun. There are certain things that we can do that are really easy that we can get work into our regular routine when it comes to sun protection. And if we work in either our clothing choices with our use of sunscreen products as part of our daily routine, then it becomes just something that we don't even have to think about, and it pays great dividends later on. If we have a product that we use on our skin that has SPF built in, then you're a step ahead. You don't have to worry about getting something separate. Usually, most people, when they think about putting on sunscreen, it's maybe a little dollop, rub in, maybe a little spray, and you're done. Most people don't use enough, and it's usually not applied as often as recommended. So our usual recommendation, and this comes from American Cancer Society and many other resources, is to use product with SPF of at least 30 that has broad spectrum protection. So it should say UVA and UVB coverage. If you're using a lotion, using about an ounce, so that's maybe a palmful or maybe about a shot glass worth of sunscreen lotion applied to your arms, legs, feet, face, everywhere that's exposed, and then reapplying appropriately. So for most products, that means about every 2 hours, or if you're sweating or if you're swimming, it may be more frequent. A lot of people ask about chemical versus mineral sunscreen because maybe they heard something in the news about certain products and questions around safety. If you're concerned about chemical sunscreen versus mineral sunscreen, uh, there's really still the same recommendation from the FDA, which is use it. There's a lot of discussion around how we want to move forward making recommendations, but biggest thing we can say right now is use something that you're comfortable with every day that you will be more likely to apply. So I like a mineral sunscreen with an SPF of at least 30. That's easy to rub in. Nice thing about a mineral sunscreen, you can look on the label. It'll say maybe titanium oxide or zinc oxide is an active ingredient. It goes on it feels like it goes on pretty thick, but you can tell where you've applied it and where you've rubbed it in. So it also gives you a better idea of what kind of coverage you have. In terms of reapplication, we mentioned a little more frequent if you're going to be in the water. So between 40 and 80 minutes if you're swimming or if you're at the beach or sweating during outdoor activities. Also, if you're going to use a spray sunscreen, you definitely want to make sure that you're rubbing in after you spray. It's quick to apply. I have kids. Oftentimes it's easier to have them hold still for a minute just to do a spray down. But if it's not rubbed in, you run the risk of not having protection in places where the spray didn't reach. Also, we don't want to spray into our face because there's risk of inhaling the sunscreen. So the best way, if you just have a spray sunscreen, is to spray it into your hand and then use your hand to apply it to your face. A lot of our patients have questions about what to do in terms of their current regimen. Certain chemotherapy, biotherapy, certain treatment options can make your skin more sensitive to damage in the sun. There's a slogan that comes into play when we're talking about overall sun protection that definitely plays a role if you have higher risk for sun damage with your current regimen, and that's to slip, slop, slap, and wrap. So first, you slip on long sleeve shirt using clothing as sun protection. You slop on plenty of sunscreen at the correct time interval. Slap on a wide brimmed hat or a shade cap that has shade that covers your neck, and wrap on UVA or UVB protective sunglasses to protect that one piece of your body that you can't put on sunscreen, and that's your eyes. We talked about medications and treatment options. There's certain oral medications that may make you more likely to have sunburn. Drugs like Xylota, the generic is capecitabine, or vemurafenib. There's also IV medications like cetuximab and fluorouracil. and panitumumab that we use with some frequency that could also increase your risk of sun damage. You always want to consult your care team here at City of Hope if you experience any kind of skin reaction or pain compared to where you started when you began treatment with that regimen. Some regimens can be adjusted to avoid these effects. Other medications that aren't necessarily related to cancer treatment can also increase your sun sensitivity. There's some antibiotics like doxycycline or Bactrim or Levaquin. Other medications sometimes used for blood pressure support like HCTZ, hydrochlorothiazide, or metformin for use in treatment of diabetes. So these are maybe maintained by a physician outside of City of Hope. If you have questions about the potential for sun damage on these medications, it's always best to ask your care team, and your care team includes your pharmacist that's dispensing that medication. They can provide you with good information as well. Some medications used in treatment of cancer can even add risk after you've completed treatment. Certain medications like docetaxel, doxorubicin, etoposide, gemcitabine, or methotrexate, it can produce something called a recall reaction. So if this happens, or you fear you may be at risk even after completing treatment, talk with your care team. There are things that you can do aside from what we've already discussed to try and provide additional protection. It's fun to be out in the sun, even in Atlanta when it's a million degrees in June, July, and August. It's important to take the steps necessary to make sure you can safely enjoy the time that you have out in the beautiful Georgia weather. Thank you so much for your time.